So as I told you, this is the second time I conduct this webinar, and I want to start by sharing with you the journey that I took till I became one of the 36 persons certified as healthcare risk management professionals by the American Society for Healthcare Risk Management. Those 36 persons are outside United States. So during my master's study, we were two groups, healthcare management and healthcare quality and safety. I was studying healthcare management. Which group do you think studied one full module on risk management? It wasn't the quality and safety group, it was the healthcare management group. The management group studied one full module on risk management. That's because risk management is a management issue. It's not a safety issue. So in 1928, John Shedd released a collection of sayings titled Salt from My Attic, and the following popular aphorism was included. The aphorism was, "A ship in harbor is safe, but that's not what ships are built for." That's true because ships are built to sail, not to dock. So risks are part of doing business. Failure to manage risks effectively can lead to harm or injury to persons, also to your organization, the financial losses of your organization, the loss of your reputation. And as William Deming said, quality comes from sufficient risk management. James Lamb stated that the only alternative to risk management is crisis management, and crisis is much more expensive, time-consuming, and embarrassing. The second fundamental shift in my way of thinking towards risks was when I realized that risks are not only bad things. Good things are also risks, provided that you were uncertain of them and they would affect your business objectives in a way or another. So risks are the uncertainty that, if occurred, will affect your objective. Luke Feeney and Dennis Murphy defined the risk management as being a process of identifying, evaluating, developing response, implementing, and monitoring risks to people and organizations. Risk management is anticipatory and proactive process, and it is a systemic application of management policies, procedures, and practices to the tasks of establishing the context, identifying, analyzing, evaluating, treating, monitoring, and communicating risk. As you can see here in the ISO 31000 standard, communicating risk is an essential part of all the risk management steps and stages. Communicating risks is defined by the WHO as any purposeful exchange of information about risks between interested parties. In 2018, I met Professor Job Groenweg. He's a professor of psychology, and he is the last surviving member of a team led by James Reason, the well-known James Reason, the same team who developed the Swiss cheese model and this maturity framework. And Professor Job, who is a psychologist, told us a funny story behind this framework. He said that the early version of this maturity framework was 8-level framework, but Shell company, the oil company, requested to shrink it to 5 only, because that's the maximum number of levels the engineers can handle. The bottom line here, the bottom line of the risk maturity framework is to have a successful risk management program, This depends on the cooperation of all your employees. And the coordination of all risk management functions is important to eliminate fragmentation, duplication, and resource waste. In hospitals, this is typically the function of a risk manager or the quality manager if well trained on risk management functions. If centralization is not possible, the administrative team, the hospital director, the department heads, or the division heads should be assigned the responsibility for the appropriate functions. A good risk management system creates an overview of the organization's risks and how they are managed and communicated on all levels of the operational phases to cover the whole spectrum from the early prevention to incident analysis. Also, the traditional risk management was established in the early 70s, focusing on the acute care settings. These programs stayed reactive and generated in response to incidents that were ultimately patient safety-centered. The process was fragmented into silos of responsibilities and accountabilities with no overlap or relationship between different business units. Over years, this approach was replaced by a holistic risk management view, which comprises the clinical and administrative silos that is commonly identified by the literature as enterprise risk management, or ERM. Aiming to do that, to have an ERM, the American Society for Healthcare Risk Management extended the domains covered by risk management program to include 7 more domains in addition to the clinical/patient safety one. BowTie is listed as a tool used in healthcare enterprise risk management and stated in the American Society Healthcare Risk Management books. BowTie combines contributing factors and consequences and both preventive and recovery measures in one model that brings to mind the shape of the men's fashion accessory with the same name. At the center of each BowTie is an initiating event, the top event, or the moment when a loss of control over the hazard or critical operation happened. Providing the right level of details to facilitate understanding and risk-based decision-making without oversimplifying. The right level of details depends on your goal. So a BowTie is like a map, a representation of truth that enables risk to be understood with the risk treatment strategies. So far, in healthcare, no risk analysis tool So far in healthcare, no risk analysis tool has been developed to proactively analyze and visualize risks in a comprehensive way. Contrarily, other high-risk industries such as mining, aviation, petrochemical, and nuclear power have frequently adopted the BowTie. Although BowTie has been used in managing process safety risks mainly, it may also be used to manage other risks as strategic and financial ones. That's why BowTie can be used in enterprise risk management. To know the history of BowTie, it's said that the first real BowTie diagram appeared in the Imperial Chemistry Industry course notes of a lecture on hazard analysis given at the University of Queensland, Australia, in late 70s. but how and when the method found its exact origin is not completely clear. Then the catastrophic incident on the Piper Alpha platform in 1988 awoke the oil and gas industry after the report of Lord Cullen, who concluded that there was far too little understanding of hazards and their accompanying risks that are part of operations. The urge rose to gain more insight in the causality of seemingly independent events and conditions, and to develop a systematic way of assuring barrier over these hazards. In early 90s, the Royal Dutch Shell Group adopted the BowTie method as company standard for analyzing and managing risks. Shell facilitated extensive research in the application of the BowTie method and developed a strict rule set for the definition of all parts based on their ideas of best practice. The primary motivation of Shell was the necessity of assurance that appropriate risk barriers are consistently in place throughout all worldwide operations. Following Shell, the BowTie method rapidly gained support throughout the industry, as BowTie diagram appeared to be a suitable visual tool to keep overview of risk management practices rather than replacing any of the commonly used systems. In the last decade, the BowTie method also spread outside the oil and gas industry to include aviation, mining, chemical, maritime, healthcare, cybersecurity, and so on. BowTie was created by mixing two existing risk analysis tools, namely the fault trees and event trees. Fault trees flow from bottom to top, the one that on our left hand side. The fault trees, as we said, flow from the bottom to top, while this is the fault tree, while the event trees work the other way around. They start with a single event and model what consequences can result from that. They do that by having combination of conditions, and based on a particular combination, a certain consequence occurs. Often, event trees also have calculated frequencies for their consequences. So the goal of both trees, the ancestors of BowTies, is to calculate probability or frequency, and their scope is mainly to be used in the design phase. However, BowTie add the two together and form one diagram, and the goal of this diagram is to communicate risk, and its scope is to be used in operational risk management. One way of better and controlling and understanding risk is by introducing the barrier concept. This concept was popularized in the 80s with the introduction of the Swiss cheese metaphor by James Reason. Based on barrier thinking and the well-known Swiss cheese model, the BowTie methodology was developed by Shell to integrate the understanding of how accidents happen with the risk assessment. So as stated by George Box, all models are wrong. The practical question is how wrong do they have to be to not be useful? Reality can be chaotic. You may prefer to use models to make a jump in the abstraction level to make sense of reality. Compare here a list of London Underground stations with a row diagram of the map of the Underground created in 1865 and schematic map which enables the pathways to be clearly seen, the intersections, the actions to take if there are any issue encountered. As you can see, diagrams assist the one to predict, infer, understand, and process cause and effect. So a BowTie is like the map, a representation of the truth that enables risks to be understood with the risk treatment strategies. The BowTie describes how isolated or combined events and circumstances on the left-hand side of the diagram can release a hazard and lead to an undesirable event with consequences of harm to assets, people, environment, and more on the right side of the diagram. All steps in risk management cycle, as described earlier in the ISO 31000, or if you want to link it to enterprise risk management, all these steps were covered by the BowTie methodology. To create a BowTie, you have critical components. The critical components of BowTies are hazards or threats, top events, and consequences, with barriers inserted to stop hazards from turning into consequences. Barriers can either prevent top event from happening or after the event mitigating the consequences. The reliability and effectiveness of each barrier is determined by the organizational activities such as design, engineering, and operations. Moreover, escalation factors that could undermine the effectiveness of the available barriers are also plotted. Strong barriers based on design make failure less possible, unlike the soft barriers such as procedures and competencies. Not only for risk assessment, BowTies as a structured way of visualizing how hazards are controlled and how consequences are mitigated also provide a framework for audit and incident analysis. So, as we said, BowTie is a visual and qualitative method to assess risks. To mention some of the practical advantages of BowTies, here, as you can see, we have 2 threats and 4 consequences and 5 barriers. So we have 2 threats, 4 consequences, and 5 barriers. This is in the table 4. You might think that the 5 barriers are enough to control and mitigate your risks, but when you plot them on a BowTie, you will find that all the controls are on the left side, trying to prevent the threat. So if the top event occurred, all consequences are exposed. So the top event will lead to consequences. Here, when you have a full picture of the risk, you can identify where to act and add more barriers to prevent or mitigate risks. The comprehensive and integrative characteristic of enterprise risk management approach requires good communication through a reliable risk management information system to improve performance as well as provide an overall cost reduction by automating routine tasks and synchronizing risk management efforts across the entire organization. So these are the added values of having risk management electronic information system or risk management platform. Having assigned the barriers to specific staff. So here, as you can see, those two barriers are assigned to the same staff. So when those staff are absent, you can easily identify when the barrier may fail because the responsible staff was absent. A second added value is by linking your audit result to your current barriers. So you can view the effectiveness and reliability of your barriers, either by asking your staff how they think, maintain, or observe the effectiveness and reliability of different barriers. As you can see here, the green bars here represent the positive responses, while the red ones represent the negative responses. The traditional audit system focuses on maintenance, while a barrier-based audit that match the BowTie barrier-based risk management approach includes a wider spectrum. It monitors all activities related to each barrier, like training and time scheduling. The third added value of the electronic information system is due to integration with the incident reporting and analysis system. Your BowTie will display the different conditions of your barrier which has been present in a related incident. So as you can see here, using the same barrier-based thinking, this allows learning from incident. This is the incident. When you analyze the incident, your output will feed your current BowTie to improve the barriers. Moreover, it facilitates the consistency in thinking while planning for risk management or analyzing incidents. So you take one scenario of your risk if an incident happened, and you analyze that incident. You have here, you can use more than one way to analyze your risks. I prefer the barrier failure analysis. In barrier failure analysis, you do root cause analysis for every single barrier to assess its status during the incident. So this is the final outcome of the incident, what happened before and what led to that, and then you have one barrier here and 4 barriers here, and you comment on every single barrier what happened to that barrier. So if the barrier functioned as planned, like this one, and stopped the next event in the incident scenario, this is an effective barrier. If the barrier stopped the incident sequence, but you were uncertain if it will do so in the future, this is unreliable barrier. If the barrier functioned as intended by its design, but was unable to stop the sequence of the event, this is inadequate barrier. If the barrier was implemented but didn't function according to its intended design, so the barrier didn't operate as it was broken or defeated, this is failed barrier, and the last one is missing barrier, when the barrier was described in your organization safety management system or was considered as an industry standard, but it wasn't successfully implemented. The barrier is required but was not installed at any time. This is a missing barrier. Who is responsible to do these activities? How can we make sure what we have on paper will function in reality? To ensure the integrity of the barrier, you can assign accountabilities and activities, or evaluate risk scenarios by placing effectiveness values. There is a variety of information that you can link to your BowTie to really make it visual representation of your safety management system. By linking all sorts of safety management system information, your BowTie becomes alive. And another way or another value added is the easier communication by having one centralized cloud. From this centralized location, you can access all the data. A reliable risk management information platform improves the performance as well as provide an overall cost reduction by automating routine tasks and synchronizing risk management efforts across the entire organization. So if your organization has multiple sites, you can access all of them from the central part. And this is the dashboard of your BowTie server, and it is customizable. You can customize it according to your preference. You can see how different assets, people, environment, and reputation risks are doing all over the different places. You can also create audits and send them, and you can access also the incident management system. You can follow all your activities from one central location. So finally, it is impossible to represent the full complexity of reality, as modeling is intended to reflect the necessary details to understand the modeled subject in some way. The goal of BowTie model is not to reflect reality in an extensive way, but to communicate risks in an understandable way to audience, to estimate the design requirement of a control measure, to show if the risks have been reduced to a practically acceptable level, to analyze incidents, or to build a risk-based audit. This is my published article about enterprise risk management and how BowTie is used as a tool to comply with the American Society for Healthcare Risk Management recommendation to use enterprise risk management. So that's it for the presentation. And if there anyone want to comment or ask any question, please go ahead. You can unmute yourself if you prefer to type the question also. Thank you, Salvi. Any question? Proceed. You have a question? Thank you, Ehab. Okay, Jailan, you might have a problem with your audio system. Okay, can you type your question? Okay, type. Okay, Jailan. Go ahead.
Okay. Thank you for the presentation. It's the second time for me to attend, and still I learned more than the other time. I have a question.
Okay.
You first explained that the risk management is related to management more than safety.
Yes.
Yeah, but this is in contrast to the BowTie, as it started first for chemical hazards.
Yes.
So how is BowTie can be used for other incidents?
Yeah.
It can be used also for incidents like medication errors, medical incidents related to patients, or only safety hazards.
Okay. So we can use your BowTie for any patient safety related risk. But the BowTie could be used also for different risks, not only for safety. It started as a safety related risk management or risk analysis approach, but now the the major companies like Shell and I think British Airways also, both they stated that they are using BowTies to manage their operations, not to manage their risks. So any critical operation they have, any operation that is related to a core business issue, they put all the threats that can affect that operation on the left side and all consequences on the right side. So yes, we can use BowTie for patient safety related risks, but I prefer to use BowTies to manage all our operations in healthcare, strategic risks, legal risks, technical risks, and all other types of risk according to enterprise risk management.
Okay, so the barriers that we are assigning to the staff, so are they particularly for the type of incidents or the incidents that are happening frequently? So is it used to avoid the incidents or to improve the performance?
Yeah, you put two types of barriers here. You have barriers on the left side to prevent the risk or the threat from turning into a top event. And if that happened, you put mitigating barriers or recovery barriers to prevent the top event from turning into consequences. Okay? So yes, you can identify your barriers based on the analysis of your incidents, but you can use other approaches to identify risks and consequences, such as failure mode and effect analysis, maybe from the reports from accreditations, reports from environmental assessment. And if you went to literature, you will find those risks and what consequences might happen from them. Ihab said, yeah, it's. I believe it's a multidisciplinary strategy to be implemented within healthcare setting, whatever the risk is. Absolutely correct. This is what is BowTie about. You have to use BowTie or maximize the use of BowTie to cover all the risks, not only patient safety risks. However, as healthcare is not that much advanced in risk management, you can start by patient safety related risks, and then you cover the other areas. As you all know, risk management is a very dynamic activity. It's not about developing a plan and then you keep it in your drawer or that's it. No, it is a very versatile activity. You will add every day new risks, and you will remove the retired risks. You will reassess the current risks. You will assess the current controls, and so on. So yeah, your contribution is absolutely correct. Eventually, we are doing the right thing for the right reason at the right time. Yes, correct. Okay.
Okay, thank you so much.
You're welcome. Any other comments? Any other question from Ihab, from Rabab? Thank you, Ihab. Thank you for your contribution. Much valid. And Rabab, okay. So that's it. This is the end of today's webinar. Please keep following my posts on, and thank you, Rabab. Keep following my posts on LinkedIn. I might post an announcement for another webinar. Maybe I think the next one could be on conflict management approaches and those things. Thank you and have a nice day.